In today's KSAT Q&A, we are joined by Mayor Ron Nirenberg, who just moments ago, earlier in this show, gave the latest numbers on the continued spread of COVID-19 here in San Antonio. Mayor, thanks for being with us. Those numbers keep on rising, and especially those numbers of people hospitalized. Is there something that you feel like San Antonians just aren't necessarily getting about the spread of this virus?
You know, it's tough, Myra, because, the effects of our decisions in terms of how we see the infection rate, we feel the effects of our decisions in 2 and 3 weeks later. So, I think these last couple of weeks have really rattled everybody because we see how quickly the cases are rising, particularly the hospital numbers. And I am starting to see more concern. I'm seeing people, want to get tested. I'm seeing more masks. I'm seeing the physical distancing become much more in the front of people's minds again. So I think we're starting to see people make corrections, but that doesn't, unfortunately, take care of what happened 2 weeks ago. And so we're going to see these numbers rise for a couple of weeks more. And hopefully the decisions that we're making now are smarter and we can start to get a grip on this virus.
I know that you mentioned in the news conference today that you've talked to other mayors from major Texas cities and you kind of share the same sentiments. What can be done more than what you're doing right now?
It would be great if we could, with the state's cooperation, have a little bit more locally focused action. Unfortunately, with the state's blanket orders, they really handcuff local communities from making quick decisions and taking local action to limit the spread of, in particular hotspots. The mask order, for instance, was after a lot of political wrangling, finally finding a path for us to mandate masks again. But we know that's one of the best ways we can slow the spread of the virus. So, I've said from the very beginning, as Texas was beginning to open up, we don't have the benefit of data to verify that we're making good decisions. And so we're starting to see the effects of us opening up too fast. So our hope, as mayors, I would say, is to have a little bit more locally focused action and local control and slow this down a little bit, because we're just blowing through each phase of these opening of the various opening of services and businesses that is causing people to lower their guard. And I think you're starting to see the results of that.
The use of face masks has become divisive for a lot of people. You heard about what happened with Judge Nelson Wolff earlier today. We reported it here, the confrontation he got in with a customer at a store who refused to put on a mask. Tensions are high right now, not only about the masks, but just the stress of this pandemic. What was your reaction to what happened there?
No, people are anxious. They've had to be confined in their homes. People have lost their jobs. We've seen livelihoods, almost vanish. And, the stress level is extraordinarily high. And so when you layer on mandates from government, it doesn't help people feel better. But the truth of the matter is this is about saving people's lives and maintaining the health of the community. We don't want to do these orders any more than people want to have them imposed on them. But the truth of the matter is, with regard to mask wearing, this is public health guidance. It's one of the best ways we can slow the virus. And unfortunately, politics as it is, partisanship has entered into the conversation now, and you have people equating wearing a mask with individual liberty, which is absurd. Wearing a mask is protecting other people from you if you are potentially carrying the virus. It's a sign of respect. It's a very simple thing we can do to help our communities, our businesses reopen in a safe and healthful way. And it shouldn't be politicized. This is simple public health guidance that we can get on board and really start to help our businesses, help each other. And I really believe that the San Antonio community is hearing that message by and large. We just have to continue to work together.
Mayor, are we, and I want to say the media, elected officials, you name it, are we not doing a good enough job conveying just how serious this illness is, what it does to the body, what it does, to the society that we live in?
No, I wouldn't say that at all. I think, people are being bombarded. They have been for 3 and 4 months now with this. And the danger is we hear about it every day. We hear about it on in various ways. It becomes sort of background noise for folks, especially if politics starts to twist some of the message. That's the danger. What I hope we can accomplish, though, is for us to ensure that we're consistently putting our medical experts and public health officials in position to deliver the truth, the good, the bad, and the ugly of this virus, and what we can do to protect ourselves, our families, and our businesses. And that's really our focus. But we've got to keep people's attention on this. I think the media locally are reporting it and just the way we would want to. And we're also all learning about this, by the way. It's a novel virus. There's a lot to learn from a medical aspect, but also in terms of the public information. And I think we're working together in that way. We just got to continue to do it.
Can you quickly tell us what you're hearing about the hospital capacity right now? Because that hospitalization number continues to go up and up and up.
It does. And that's the acceleration of the rates, acceleration of the infection rates are what is really concerning, because we do have capacity in the hospitals. We have a healthy number of staffed hospital beds. We still have a healthy number of ventilators. We still have a healthy number of ICU available. And so that is good as a snapshot. But we're seeing this infection rate rise so quickly that can turn in a heartbeat. And so what the hospitals are being forced to do is go through their surge planning right now. In some cases, defer some procedures so that they can make space for COVID patients. And then in other cases, we're having to look at when we're going to trigger alternative care facilities. So all of this is a work in progress, and it's a dynamic situation. But it is concerning how fast these infections have risen over the last couple of weeks. And what we can do as a community is slow that down. That's exactly what flattening the curve was all about.
Mayor Ron Nirenberg, appreciate your time. And of course, we'll see you back here tonight on the Night Beat. I want to talk about the pandemic and the budget and priorities and how that all plays out. So thanks for your time, Mayor.
Thanks, y'all.
We'll be right back.